Let's discuss with emergency room physician Dr. Megan Ranney. She's the dean of Yale School of Public Health. Doctor, thank you so much for being with us. What's your reaction to the court's decision?
This is a victory for science. This is a victory for our regulatory process for medications in the United States. And it is, of course, a victory for women and families who are seeking access to these medications. But the fight is not over. They made so clear in their decision, as your previous commentator mentioned, that this is still in the hands of legislators and the executive branch. The elections ahead matter, both in terms of who we elect as legislators, in terms of ballot initiatives to preserve access to medication abortion, and of course, in terms of the executive branch, knowing that that's who appoints the head of the FDA. And if we're going to continue to have a science-based process of approving and retaining approval for medications at the FDA, we have to make sure that the head of the FDA is still empowered to act based on science. But overall, I and many others across the country are quite relieved by this decision.
And as Paula mentioned there is this other issue that we are waiting for on abortion from the Supreme Court, which has to do with whether Idaho hospitals must provide abortions for women whose health is at serious risk. As an ER physician, how important is the court's decision on this?
So that decision is the one that worries me as much, if not more, than this one. As an emergency physician, I have a responsibility to take care of anyone who walks through my door, to stabilize them, to save their life, to do whatever procedures or treatments are needed in order to save them. If that Supreme Court case goes the wrong way, it is going to limit the ability of physicians and other healthcare providers in Idaho and likely in other states to be able to save women's lives. It is going to literally result in deaths. It is going to result in doctors and other healthcare providers leaving those states. And it is going to further worsen our already abysmal maternal mortality rates in this country.
So, doctor, you're obviously an ER physician at a teaching hospital. I'm wondering if you've had any conversations with medical students that might be making decisions about where to start their careers based on varying state laws when it comes to abortion.
Medical students, residents, so people that have finished medical school and are in training, and public health professionals are all making decisions to not move to states with restrictions on abortion because they are afraid that they are not going to be able to provide the care that is needed, both to respect a patient's autonomy, but also potentially to save a woman's life. It is absolutely impacting those decisions, and I hear it on an almost daily basis.
It's really interesting. Dr. Megan Ranney, thank you so much for being with us on a very important day. We appreciate it.